Even as we speak, Congress is preparing to introduce and debate health reform legislation that is the product of many months of effort and deliberation. And if you're like any of the Americans I've met across this country, who know all too well that the soaring costs of healthcare make our current course unsustainable, I imagine you'll be watching their progress closely. I'm talking about the families I've met whose spiraling premiums and out-of-pocket expenses are pushing them into bankruptcy or forcing them to go without the checkups or prescriptions they need. Business owners who fear they'll be forced to choose between keeping their doors open or covering their workers. Americans who rightly worry that the ballooning costs of Medicare and Medicaid could lead to fiscal catastrophe down the road. Simply put, the status quo is broken. We cannot continue this way. If we do nothing, everyone's health care will be put in jeopardy. Within a decade, we'll spend $1 out of every 5 we earn on health care, and we'll keep getting less for our money. And that's why fixing what's wrong with our health care system is no longer a luxury we hope to achieve. It's a necessity we cannot postpone any longer. The growing consensus around that reality has led an unprecedented coalition to come together for change. Unlike past attempts at reforming our healthcare system, everyone is at the table: patients, advocates, and health insurers, business and labor, Democrats and Republicans alike. A few weeks ago, some of these improbable allies committed to cut national health care spending by $2 trillion over the next decade. What makes this so remarkable is that it probably wouldn't have happened just a few short years ago. But today, at this historic juncture, even old adversaries are united around the same goal: quality, affordable health care for all Americans.